move your neck in all directions safely. It's like use it or lose it. Namaste friends. I'm Ritesh and today we will cover the second part on neck alignment. As yoga has grown in popularity, so have yoga injuries. Naturally, people are constantly trying to achieve the challenging and impressive asanas that they see on social media. Yoga instructors are pushing themselves to do challenging moves like a headstand in order to impress their social media following. Friends, ancient yogis do talk about calming the mind, but less emphasis was given on alignment. And most of the classical books on yoga has hyperextension of the neck. We have already discussed this in part 1. But friends, today yoga practice is more physically oriented, and I believe that's also fine because it's only through the body that you can connect to the mind. Friends, lots of injuries are happening in yogic asanas. As a yoga teacher, I don't want to send out the wrong message and instill a fear of injury in people who are interested in experimenting with the practice. A well-known orthopedic surgeon, Dr. Jeffrey Helbrecht, MD, Medical Director for the Institute of Arthroscopy and Sports Medicine in San Francisco and a specialist in knee and hip problems, says, "In my practice, I've seen a significant increase in yoga injuries in the past 5 years. And it's not only those in the recent wave of newbies who are getting hurt. I have treated more experienced yogis than rookies." Yoga is such an incredible form of movement that is truly meant to heal your entire being. If you listen to your body and you take care to not push your limits to a point where things get too uncomfortable, you can easily avoid getting injured during your time on the mat. Friends, we are mostly forward head posture. Thanks to the technology, it's a good servant but a bad master. Our mobiles, laptops, sofas contribute to a forward head posture. In fact, earlier we had students with lower back issues, but now we have complaints of lower back, upper back as well as the neck issues. Now, to understand why we should not hyperextend the neck, we need to understand a little bit of anatomy of the muscles. So there are long and weak and short and tight, also known as a upper cross syndrome. Now the reason we have upper cross syndrome is because we all, including myself, have a forward head posture. Now, what happens if we have a forward head posture? It increases the workload on many muscles that are attached to the cervical spine. These muscles stabilize the neck, but over time, forward head posture can lead to muscle imbalance. Some muscles become weak and long and other become short and tight. The muscles that help to flex or bend the neck are the muscles that become long and weak. Due to forward head posture, deep cervical flexors in the front of the neck, we have longus capitis and longus colli that stabilizes the neck and are located along the front of the cervical spine and help stabilize the neck. But now, when you have a forward head posture that is also known as chin poking, these muscles become long and weak. And friends, that is the reason we do chin tuck, right? And even your upper back, that is your erector spinae, your lower cervical and upper thoracic, that is where the erector spinae muscles lengthen and lose strength. They are less capable of keeping the neck and upper back from hunching forward. Shoulder blade retractors are middle trapezius and rhomboid muscles in the upper back. Helps to bring the shoulder blades backward to keep the shoulders, back and chest open in a good alignment. Now if trapezius and rhomboid muscles are long and weak, it will contribute to hunched shoulders and a forward head posture. Muscles that help to extend the neck or take it back becomes short and tight are due to long-term forward head posture. These are four pair of small muscles are rectus, capitis, posterior, major and minor, obliques, capitis, superior and inferior, which connects the lower back of the skull to the top of the cervical spine, helps in rotation and extension. These muscles work extra hard and continually contract to keep the head tilted up and looking straight ahead during forward head posture. Chest muscles. As the muscles in the upper back tend to become elongated as the shoulders round forward, chest muscles may become shortened and tight. And an example includes the pectoralis minor muscles, which are a pair of thin triangular muscles in the upper part of the chest. Levator scapulae muscles is a pair of muscles on the back and the sides of the neck, traveling from the upper cervical spine down to the shoulder blades, that is your scapula. The levator scapula plays a key role in lifting or elevating the scapula, in addition to helping with various neck movements. If the shoulder blades start tilting forward and rotates up with rounded shoulder, the levator scapular muscles may be shortened. These muscles are commonly the focus of stretches to help reduce neck pain and improve forward head posture. After understanding the neck anatomy, let us assume that you have a forward head posture where your neck is long and weak, short and tight. In a forward head posture, your C1 and C2 is extended. C3 to C7 is flexed. And now you are practicing Bhujangasana. Your neck is hyperextended from a forward head posture. Hyperextended neck, there will be a lot of compression on your C1 and C2, that is your atlas and axis respectively. In the ancient days, yoga practitioners' neck was aligned, so extending the neck was not a problem because the neck flexors and the extensors were properly aligned. So extension and hyperextension was not a problem, and that is the reason you find in the olden books of yoga most of the asanas done was hyperextended or extended, but today's scenario is very different. So friends, it's safe to extend or hyperextend the neck if your neck is properly aligned and your neck extensors and flexors are aligned. Friends, in the first part I talked about the hyoid bone and why hyperextension of the neck is not a good idea, because it misaligns your core, it misaligns your rib cage. So the first part was very important. In the second part, I thought of directly going into the asanas, but it's important that you understand the anatomy first, because so only when you understand as a yoga practitioner or as a yoga teacher, then while doing the asanas, you can understand which muscles are being involved. So that is the reason this second part was very important, and it might take some time for you to understand the anatomy, because as yoga teachers, I know my anatomy was really very weak. So it takes some time. So I will request you to go through the part 2 of this anatomy at least twice and thrice. So in the third part, I would be now talking about the asanas, which muscles are tight, which muscles are weak, and how can we work on the asanas to strengthen those muscles, to stretch those muscles, which muscles need to be strengthened and which muscles need to be stretched. It should not go opposite, because then you will create more problem. Fine, that is the reason. Please go ahead and keep watching the part 2 again and again. It just gets registered into your mind. And in the third part, I will be talking about asanas, practical. So just go through it, understand it, and in my third part 3, I'll be talking about all the asanas. I'll take a good time for you to understand anatomically what we are doing. And I'll be taking the support of the neck flexors, the neck extensors, so it will become easier for you to understand. That's the reason. Keep going through the part 2 series. Okay friends, see you soon. Keep smiling. Take care. I'll see you in the part 3. Till time, namaste.